We'll and our meeting sponsor is here with us today, and you'll hear from Lauren here in just a little bit. So official welcome. My name is Laura Steigelman. I've got a company called Florida Training Solutions. I do this kind of stuff for my day job. I'm very happy to be here with you, and it's really just an honor. This is one of my very favorite meetings every single time. I learn so much. It helps me help others. And I say to folks, gosh, you should know about this resource. This is out here. Have you contacted these folks? And a lot of it is absolutely from the senior roundtable meetings and the speakers that are brought in. Elder Source does tons of this work behind the scenes. So again, Gabby's on here. Carrie, anybody that's with Elder Source, if you'll give us a wave. Anybody that's an Elder Source person. If you haven't connected with Elder Source yet, personally or professionally, they are fantastic. They have so many different things that can help you. And for us, they do all of the things behind the scenes. I mentioned that just a couple minutes ago, if you're already in the meeting. They do the email distributions. Gabby puts a whole email invite together. They manage the email list of who it's going to, all of those things behind the scenes. And they're a huge part of the planning of these meetings, getting the right speakers, the topics that you'd be interested in, et cetera. So Gabby and Andrea, thank you so much. And then the Community Foundation founded this group. And I think everybody here that's been here for a while has heard that story. They were starting to really focus on the senior sector in their grants, and realized that a lot of them didn't know that each other were out there, all these different organizations, all working really hard to serve seniors. So they put this together as a way for folks to network with each other and to gain some important information like our topic today, medical marijuana. They are a funder and supporter. And again, Janet, if you will be willing to give us a wave there. Janet is their liaison with the Community Foundation. We so appreciate everything that they do. This is why Senior Roundtable exists and still continues today. The meeting is recorded and it will be available via YouTube. We've put those on there, I think, really probably since COVID started. We've got all the meetings recorded. So if you need to come back to them or you want to let somebody else know about, gosh, I just attended this program, I think it would be helpful for you to have it too. It's out there and it will be open to everybody. And so we usually within a couple of days after the meeting is over, we get those posted on there, and then Gabby will send that link out to everybody to say it is posted, it's available, please enjoy it or go back and visit it, tell others about it, etc. So you always have that option if you want to come back to any of the material that is presented. If you're not familiar with Zoom, if you're not spending a ton of time on Zoom, I'll just do a quick kind of overview. There's what we call a Zoom ruler along the bottom of the screen. And on the Zoom ruler is the mute button. You can mute and unmute yourself. There's also a chat box. So if you'll click on that chat box, our producer today, Mac, will be putting in just a hello in there because you can kind of see how the chat box works. And then you can also mute yourself or unmute yourself over your own video feed. So there's a couple places that you can mute or unmute in that video feed. There's that option there. You'll see that pop up as well. And again, if you're willing to include your first and last name, networking, anytime we've done a survey in the past few years, when we say, what do you gain? What's one of the most important things? Networking is always at the top of the list. Great program information, all of that kind of absolutely goes in there too, but everybody likes to know who's here. And there may be some folks that you've been on emails with and never been in with the meeting. So that's kind of nice to be able to see who everybody is. And then if you're willing to put your video on, it does make a huge difference. It just brings energy into the room. We get that eye contact, the head nods, the smiles. And I've been a speaker before. I think they probably had 20 people in the class for this certain thing that was going on. Not a single person had their video on. I didn't even know if anybody was there. It was just like, I didn't even care if they even were paying attention. I just wanted, like, is anybody still in the room, or am I just kind of talking to myself? So it does just help that energy, especially for when our speaker starts today. So if you're willing to do that, that is awesome. And it's very appreciated. No challenge. If your technology is not cooperating or you're just having a bad hat day or something and just don't want to, completely understand that as well. So who we are, we're a coalition of anybody who is interested in that elder sector in Northeast Florida. And not that others everywhere are not welcome. There's a lot of folks here that are, in kind of the 5-6 county area to connect with each other, which we're so happy to see every time. We do meet every other month, no charge to attend. Again, mostly because of COVID, we've moved to a Zoom platform, except for the May meeting will be in person. You'll see more on that, and some save the dates will be going out here shortly on that. And the goal always is network with each other and gain information from an important topic, which today fits right into that. We're really happy about that. Mission statement, collaborative relationships is what it's all about, which fits in perfectly with that whole networking concept. So we're happy about that. So what is it that we are doing today? We're going to do organizational announcements here via the chat box. I'll talk more about that. Meeting sponsor, companion and compassion, and actually it is Lauren. So I kind of switched that around. Lauren really is actually doing the sponsorship herself. You'll hear more about that. We'll do a medical marijuana program today. You'll have a chance also to do some networking, and then we'll wrap up with a couple door prizes that Lauren herself is donating to the group as our meeting sponsor today, which we're really thrilled about. What's up? If you have any senior sector announcements, if you take a look in that chat box, and in the chat box, you can say, this event is coming up, contact me if you want information, or here's the website to go to for that, etc. So if you have anything that you would like to share with others and want to give them that information, please feel free to utilize the chat box, and you can do that throughout the entire meeting. So if you think of something even 20 minutes from now to say, you know, gosh, we need a partner for such and such that's coming up, or we need volunteers, or we've got this great event coming up that I think others would benefit from knowing. So please feel free to use that. Oh, Joanne, it's going to be in Canada on May 19th. Joanne, we will miss you, and thank you for letting us know that. And that's pretty cool for your mom's 80th birthday. And Janet's got some information in there about grants. And Janet, if you want to comment on that or say anything, do you want to unmute yourself? Is there anything you want to add?
Sure, absolutely. And I can even share the screen if that's okay.
Yeah, absolutely.
So I'm Janet Allen. I work at the Community Foundation for Northeast Florida, and I work in the programs department. And in the programs department, we're charged with doing the competitive grant making and application processes for the Community Foundation. So there are some endowed funds that we're left to us from some philanthropically minded individuals, and some of them, they have a senior focus. So I'm just going to walk you through our website. It won't take more than a minute, but our grants will open up on April 3rd. And we offer two types of grants: program support grants and capacity building grants. The program support grants can be up to $25,000 in over 2 years. And our capacity building grants are up to $10,000 and also could be done over 2 years. They don't have to be that long, but you can apply for a project that might have a longer lifespan than just a year. Some of the key dates are, April 3rd, the application opens up. Then on that date, you're also able to sign up for technical appointments if you have any questions about the process, or you have you want to share your idea and get some feedback on your idea. But once the application opens up on April 3rd, you can go ahead here on our website. It's at jaccf.org, and it's in the receive section. And either on the capacity side or the program side, you'll be able to submit your appointment request here. And then we ask a couple questions about what you might be interested in learning about, and then we can have a 30-minute conversation about the process. Some key dates there is that the application is due by May 18th. And those are the preliminary applications. We'll do a short review of those applications, and then we'll invite some forward to finish up the process. And the goal is to get the grants and the project started as early as October 1st and through the next year. So we're always open. I'm going to put my email address in the chat. So if anybody has any questions, they can always reach out to me directly.
Awesome. Janet, thank you so much. And thank you for letting everybody know about that. We always hear folks that like, oh, I got one of the grants. I got one of the grants. It's always so good to hear, and it's so impactful to the community. So Janet, thank you. And again, information will be in the chat box about that. And then Janet, if there's anything you want us to send afterwards, when we do the post meeting Monday or Tuesday announcement going out, please feel free to send that to us. We'll make sure that that gets included. So perfect example, you see some of those things that are in there right now: Parkinson's awareness. Janet put her contact information in there. So anything that you've got that you think is helpful, or if you just want to do an introduction of yourself, you're going to get a chance in a breakout room to meet some folks that are here, or at least just say hello if there's folks that you haven't seen for a while. But if you want to say what you do, where you work, what people should know about what you do, anything like that, feel free to put that right in the chat box. Okay. So if you haven't joined our LinkedIn group, we would love for you to do that. It's just a great way if you say, I met that really nice person from Elder Source and I can't remember what their name was, you can come into that LinkedIn group and there's a good chance if you do a search that you're going to find some of those folks that are in this meeting with you today. So it's always a good place. We always try to put the meeting announcements in there and those kinds of things also. So join us and we'll put that in the chat box and you'll see that again at the end. Just a reminder if you want to copy that down of what the name of the group is. So I'm going to turn it over to Lauren. Lauren is our meeting sponsor today. Lauren, you've got 3 minutes on the clock. If you will time yourself to save me from jumping in and interrupting, which I do not want to do it to anybody. So if you're willing to do that, Lauren, you've got the floor.
Okay, thank you so much. Wow, 3 minutes to talk about, 3 minutes is short, so I have to hurry. Okay, I am Lauren Bikini, and I am a senior life care executive, as we say here. I am currently working with senior nannies, and I've worked with Companion and Compassion. And so basically, I am your one-stop shop for all senior care needs. I do basically placements. So if you have someone who is getting ready to transition from their larger home, and they're going to downsize, and they're looking at independent livings, assisted living, skilled nursing facilities, which is nursing homes, so forth. It's overwhelming. And I work a lot with adult children of my clients, and we really I sit down with the family and navigate this process. So I will help with placement and working within the family's budget, pulling on the community resources, which is why I'm so grateful to be part of this group, pulling on the insurance and then and navigating those things. So some of the things I can do is work with a family about long-term care insurance. People have paid into this for many years, and a lot of folks, surprisingly, don't know how to access the care through long-term care. So I am able to help navigate that system, make sure we can get caregivers in the home to help those seniors who are needing a little additional help in the home. My goal is to navigate these systems to help families reach their goal. And if the goal is for that senior to live independently and with dignity and respect, either in their own home or in an assisted community because of their needs, then that's what we do. There's no cookie cutter answer. It's a lot of working with families, sitting down and figuring out the means, and then figuring out how to get to the end goal. Independent livings, like I said, I have a great relationship with many in the community. One of the things that also we can do is the in-home care. So I work with folks like Divya on the call with Beyond Parkinson's to make sure that we get physical therapy or needs for specific to my client, as well as get some wraparound care. If your senior needs help getting to chemotherapy appointments 5 days a week, well, I have caregivers that are trained to do that, trained to deal with dementia, trained to deal with their specific care needs, the cancer, whatever it may be. We make sure our caregivers are trained specifically to the senior's needs. So again, it's long-term care insurance. We have private pay and then also Medicaid. So Medicaid is a market where folks get a little bit lost in the shuffle. And once I'm brought in, I'm able to help with that. If we can get services through Medicaid and through that long-term care insurance that the client has already paid into, then that's where I'm going. Then we also have, if you need additional support, then I'm able to provide those caregivers. And my services are of no cost. So I will sit down with anyone who needs it. We'll figure out how this works, and then we'll figure out the best solution for them, and then we'll make that happen. I think I'm like 30 seconds. I'm gonna give a little bit example of somebody who's really close to my heart right now I'm working with. She transitioned from a very large home. She's a lot of care needs, and she was on hospice. She really wanted to give up. She said, put me on hospice, I'm done. She went into an independent living facility, and she's still going. And her care now is 24 hours a day. She has caregivers and they're helping her, and is exhausting her funds. Her money manager reached out to me and said, Lauren, help, what can we do? I went in and I've met with this family several times now. And what we're able to do is get someone in place helping facilitate a mobile practitioner to come in. We're going to get her off of hospice because that's not meeting her needs anymore, get her medication stable, and we're going to start peeling back her caregiver hours. So we're conserving her funds, conserving her money, allowing her to live in this gorgeous assisted living facility. And then also providing caregivers to help have her enjoy these beautiful facility her and her husband saved for years, but she's just unable to because she's dealing with that transition and she's taking it very hard. So my little joy this week, my big win was the first day when I walked in, she was just hysterically crying down the bathroom and wouldn't leave. And by the time I left, we had discussed that, one of the things she really missed the most was gardening. She had a beautiful garden. She really missed key lime trees. So the next time I came, I didn't find a key lime tree. I was a little nervous bringing it in. I had a lemon tree, and we have a small lemon tree, and we found a place on the balcony, and now she has something to look forward to. And so it's giving her a little bit of hope. And so we're getting her out of bed. We're getting her medication right. We're getting her caregivers correct. And I'm working with her adult son who lives out of state to make sure that her financial means are fitting her needs and we're doing it properly. And that's just a little example of what I can do. My phone number's on here. It's 904-894-7185. I'll also put it in the chat. That is my personal number. That is my personal number. No matter who I'm representing, my phone number is open to everyone. And this is something that I find joy in and that I'm also pretty good at. So I would love to work with more of you. And I appreciate the time. Did I make it 3 minutes, Laura?
You did. Lauren, thank you so much. Great information and such a wonderful resource for folks that need it, because it is just an overwhelming experience. I know that from my own mom going through all of that. So awesome to have this assistance out there. So thank you. All right. So Lauren is also donating the $25 gift cards at the end for the door prizes. So we'll hear Lauren's name again as we move through the program today.
I may have to step out early, but I promise I will give that $50 gift card. So Laura will get me the names and you'll get it in the mail.
Will do.
My word.
Absolutely.
Okay, thanks so much.
Lauren, thank you. All right. So let's give you a chance to say hello to each other. The chat is not, something's going on with Zoom. We had it happen yesterday and we checked it this morning. Something's not right with the chat box in the breakout groups. So we are going to share this screen in the breakout room. So you should be able to see it there. And here's where it says click on chat box, but you don't even have to worry about that. Because also yesterday when somebody clicked on the chat box, it cleaned off all the history on the chat box when they came back into the bigger room. And if you're trying to pull names and phone numbers and things like that off of there, that's going to be a challenge if that disappears again today. So something with Zoom behind the scenes, we checked everything we can check. So we're waiting for support from Zoom to say what's going on, probably for everybody who's using Zoom. So with that, we're going to share this in the breakout group, 7 minutes to say hello to folks. Favorite TV or movie. If you're working someplace and you want to talk about what the organization does, please share that if that's applicable to you. Whoever had the best breakfast today, if you'll just keep an eye on the time, you'll see a timer in the room with you, and just make sure everybody gets a chance to equally share before that timer goes off and it brings you automatically back into the bigger room. So enjoy your minutes with each other. We'll bring you back automatically. You don't even need to worry about that. And with that, we're going to send you to the breakout room. And again, I'm going to share this slide once you get in there, so you've got it in your breakout group with you. So Mac, we are ready. Welcome back. First question after everybody gets settled in here. Welcome back. Welcome back. Again, who met somebody they did not know? Who met somebody who's added to the network? Awesome. Love it. And then again, if you've met folks and you didn't get a chance to share your contact information or whatever, use that chat box. Grab that information so you've got it. So afterwards, if you're like, I meant to grab Eileen's contact information, I kind of forgot to do that. So please be willing to do that. So Andrew, we have a question for you. We saw you were in 2 rooms. Are you logged in twice? So somebody else is disguising themselves. So we saw you in room 1.
Yeah, Diana, is that you? I think because Diana from Florida Blue, I gave her my link. So if you go up to the 3 little dots, Diana, on your window, you can change your name. So hover your little cursor in the upper right-hand corner of your window, and then you can change. It says rename. So, but Diana might just want to grow up and be like me.
I know, it's so funny. So we can see the room. So we can see, just to make sure we keep an eye on it, to make sure that somebody's not sitting by themselves or whatever. And we said, Andrea's in room 1 and she's talking, so you can see the microphone, and she's in room 5 and she's talking. Like, she's amazing. Like, that's
What can I say? What can I say?
But the
There you
reason I was
go.
asking is we've had people before who called in on audio, but they signed in somewhere else, and then their head was in one room, but their voice was in another room, and they'll come back out. It's like, I'm not talking to the people who I think I'm talking to. They're in a different room. And then people would come out of a room and say, there's some stranger in our room. We don't know who it is because they didn't see. So we just were curious what was going on there. And it was pretty funny.
I'm so sorry. I was like, okay, I'm using her link. Now,
No.
Andrea, how in the world, what? Yeah, I'm sorry.
Diana, you're good. We're very glad we're here. We just thought that Andrea was like magical. It's like, look at that. She's got 2 conversations going on, and that's pretty amazing. We haven't seen that in Zoom before. So Diana, we're thrilled that you're here. So thank you for coming, and great to see you. And again,
But Andrea is magical.
she is magical. That's without a doubt. Without a doubt. All right. So I am unbelievably excited to introduce our guest speaker today. We have had this on the list. So we get suggestions from people in this group, the participants themselves. We have that advisory committee that comes and says, you know what, I saw this person present. It was a great topic. We should think about, that's how all of these things come together. And Pamela knew Dr. Chopra and said, he is an excellent speaker, and here's what he does, and here's his knowledge and expertise. And we were thrilled that he was available to share his background, knowledge, expertise, tips, like anything that he wants to talk to us about today under this field of medical marijuana. We were thrilled to have him. So Dr. Chopra, I'm going to stop sharing my screen. You've got the floor, and if you can wrap up about 20 minutes after or something around there, that's great, because then we'll do our wrap up with the gift cards and things like that, and get people out the door by 10:30. And then
feel free to jump in and let me know if we'll have some question time at the end. So if you want to interrupt, and we can, I can obviously share my contact, which I will, and then everybody can also ask questions after the fact.
Excellent. Right, you've got the floor.
Awesome. Thank you. Well, thank you, Laura, for moderating this and kind of organizing it and chasing me a little bit. I know I'm annoying to follow around, but thank you for emailing me and getting me to do this. I see Pam there, who I know forever. So that's great to see somebody, a familiar face. So that's good. Hi, Pam. So I may know some of you already, or some of you may know me, but I'm definitely meeting some new people so far in the breakout rooms, but nice to be part of this conversation. Just so everybody knows a little bit about me. My name is Shawn. So I'm Dr. Chopra. I'm a community physician for the last 15 years in Jacksonville. What I do initially is I own a hospitalist company. So Jacksonville Hospitalists, we're a hospital-based physician company. So what we do essentially is we place physicians inside the hospital. So if anybody was to ever, God forbid, get admitted to a hospital in the community, there's a likelihood that one of our doctors in our company, in our group, would be seeing you on the inpatient side. One thing I've done with my company over the last 15 years is really spearheaded the post-acute care side. So quickly, we're in a bunch of post-acute care facilities. So nursing facilities, rehab facilities, inpatient rehab facilities, long-term acute care facilities. So these different hospitals all over the city. The difference between us and some of the doctors you may meet in the hospital is we're a company that goes to multiple different healthcare systems. So if anybody's ever accidentally got admitted to Baptist and they're a Memorial patient, or they're a Memorial patient, they ended up going to Baptist, we are consistently in both places. So we actually meet people in different venues. So it's kind of interesting, different than working for a hospital group itself. The reason I'm here today is about 6 years ago, I got into the medical marijuana business when the state of Florida started to allow medical use from a legal standpoint, when they changed the laws. And I think it was in June of 2017, I'm going to say, maybe earlier, where they changed the laws where medical use of marijuana products became allowed. My background, other than being an internist here, is I'm a Canadian physician as well. So I'm from Ottawa, Canada, born and raised. So my whole family's there. My parents are snowbirds, so they're in Miami right now, and I'm here with them. But they're snowbirds, my whole family. I'm the only one who left Canada to work in America. And initially, pre-COVID, I was going back and forth between the two countries. So I was going to Canada, where I worked as an ER physician, and then I was coming here, where I worked as an internist. So I was doing both sides, and that was kind of the dream job, as a younger kid. Like, I'm going to be a snowbird. I'm going to work in the summer in Canada and the winter in Florida, and I could be close to my parents. I'm very close to my parents. So ultimately, when COVID happened, I had to choose a side, really, and stop going to both countries because of the limitations. So I ended up staying in the United States. full time. I'm a US citizen. I'm a dual citizen. So I work in both countries. And, one of the things that everybody always asks me, the number one question I get asked in the hospital by my patients when they find out I'm a Canadian physician, or they hear my accent, and somebody will say, oh, the way you say about is funny, or the way you say car is funny, or house is funny, or sorry, they'll say, well, socialized healthcare, right? Wow, Canada must be so different. And what I tell people is, in a nutshell, the big difference I notice between Canadian and American patients is American patients are on more medications, right? So the average American patient of the age of 75 is on more medications than the average Canadian patient. And if you go down in the age and you go down to a 50-year-old person, or I'm 41 years old, if you go to a 41-year-old male like myself, demographically, if you statistically look at the Canadian numbers, a Canadian 41-year-old male is on much less medication than an American 41-year-old male. So then the next natural question is, are you saying Canadians are healthier than Americans? And I'm saying no. If you go to Canada, Canadians eat crazy food. People are overweight. People drink. People watch sports and sit around and gain weight, and there's diabetics and everything else. So what really drives that huge statistical difference? Is our healthcare system better? Actually, socialized system and our system has been proven to be somewhat equivocal. So where does it come from? So what I tell people is, one thing people don't know in America, I found in the Southern United States, was in Canada, marijuana was a huge part of our culture growing up. Where I grew up, marijuana was decriminalized. It was not illegal to use marijuana. It was illegal to use marijuana, but you didn't go to jail for it. So I always compare it to beer in the United States. I have friends who have little kids. I have a 4-year-old, and my kid's not there yet, but my friend's 18-year-old is always asking about beer and wants a beer. Hey, Dad, I want to have a beer with you. And he's not of age yet, and he's starting to get curious about it. So in Canada, when we grew up, marijuana was considered similar to that, where a lot of people smoked marijuana. It wasn't considered something that was in the demographic of the poor people or lower socioeconomic status. Normal people were smoking marijuana. So as kids, we were around that recreationally. So fast forward 10 years, marijuana, or 20 years, marijuana becomes federally legal, and marijuana is readily available in Canada. So why I'm getting to this point is, what you're seeing is, in Canada, if you take two 41-year-old Shawn Chopras and both of them have a headache, in Canada, that person would, before they go to the ER, say, hey man, I got this headache. What am I going to do? So they would probably try to self-medicate. So what they end up doing is they actually end up getting marijuana products, or using, or going to a dispensary now where you don't need a license. You just need to be 18 years of age or older, and using a marijuana product, whether it's an edible or a smokable product or an inhalable product or an oil product, and their headache gets better. So then they don't go see the doctor, because, by the way, if you go to the ER, it's going to take you 24 hours to be seen. And by the way, if you call your primary doctor, it's going to take you 6 weeks before they have an appointment for you. So what's happened is, because of our socialized healthcare system, people have reverted to really treating themselves. So ultimately, you take two Shawn Chopras who have headaches. One guy goes in the Canadian route and goes, you know what, I got to wait 6 weeks for my doctor. My headache's bad today. I'm going to go, my friend said, take this edible, it helped them. So they try it, because you don't need a prescription, and their headache gets better, and he goes to work, and Shawn continues his life. This Shawn Chopra goes to his doctor. I call my doctor today. A good doctor could probably see me in 24 to 48 hours, even in a walk-in situation. I go see my doctor. They say, oh, you have a headache. Maybe it's migrainous hair. Take this pill. Try this as needed. Take Fioricet. I'm using an example, and take that. So now I start taking that. That helps my headache as well. So now fast forward 5 years. Now you have Shawn Chopra on Fioricet in America, and you have Shawn Chopra who's not on any medication. But really, he is on something. So this kind of cultural difference is really what drove me to get into the marijuana field. I opened the Healing Center of Jacksonville about 6 years ago. We're a medical marijuana recommending facility. So what we do is we provide the recommendation for patients to be able to go to the dispensary. So the process in Florida has grown and evolved over the last 6 years, where initially it was much more challenging. It really amounted to a lot of paperwork to get a license, with a timeline and a delay in getting that license and processing, et cetera, et cetera. And then you would get a license. And then to get that license, you needed a doctor like myself to meet you in person, sit down with you, review your medical history, and document why medical marijuana would be beneficial to you as opposed to the alternative. So if that makes sense. So people would come in and say, okay, a great example is somebody says, I have arthritis. They go, I have arthritis and nothing's working. So they would come in to see me and I would document the severity of their arthritis, what they've tried, what they've been doing so far, and ultimately be able to justify or not if they would benefit from a medical marijuana trial, and then allow them to be able to go to one of the, I think, 56 dispensaries in Jacksonville. Can you believe that? 56 dispensaries in Jacksonville, and go get marijuana products with my guidance. So the clinic started off when it was very difficult and there was a lot of paperwork and it was a lot of red tape and a lot of delay in time to get licensure. So people like myself, we want instant gratification. So I want to go see a doctor and I want to get better today. So I go see my doctor and I'm like, I want a license now. So can I go get my marijuana products? And initially it was a big delay where there was about a 4 to 6 week delay before after you saw me, before you were able to get an active license and go to a dispensary and actually get any marijuana products. So that was kind of challenging, but we kind of went through the ugly phase where we opened. The beauty was I own my business, I own my building. I'm a volunteer for my clinic initially, and I would do, I was interested in the space because of where I grew up and my cultural background and what I knew about marijuana. So we kind of went through that ugly phase where we weren't very busy. And then what started happening is, as the state of Florida is really what we should talk about. And we can talk about Northeast Florida specifically, how it culturally started to become more accepting of these alternative medicines. So I tell people I put marijuana in the same bucket as I put chiropractic work and acupuncture, where there's a lot of unformalized data that show American data that shows benefit, but there's a lot of formal data that's not American that shows a lot of benefit in different conditions. So I kind of put it in that alternative therapy bucket. And I tell people that as we've changed over the last 5 years to really, culturally as Americans and in the state of Florida, and especially in Northeast Florida, to accept marijuana more, we've seen a huge surge in the population who've come to see us. And what we've noticed is a huge focus on the elderly population. And I'm talking about 75 and up. Really, our initial clinic demographic was between the age of 32 to about 54. And that dramatically shifted over the last 2 years, where now we're seeing people, our average age is 67. And our range is more focused towards about 55 to 79. So we have a big shift in focus where we're seeing a lot of people in the senior demographic who are saying, listen, I'm interested in some alternative therapy. And really that's transformed our clinic into a venue where people come in and essentially are saying either A, hey, I'm on this medication and I don't feel good and it doesn't suit me for XYZ reason. My doctor told me this is kind of the end of the road on a treatment plan. There's really no other alternative options. I'm not a surgical candidate, et cetera, et cetera. I need to figure out something because I don't want to live in this discomfort or with this disability. And that's where we come in and say, okay, well, what can we do to attack that problem specifically? So the thing we've done a little bit different in the Healing Center is I have education on marijuana. One thing I didn't mention is that I did a lot of research on marijuana in Canada before I moved to the United States, and I trained in the United States for medicine. And what I found was interesting is very few people in America, and I think rightfully so, don't have a lot of knowledge on the pharmacology of marijuana because it wasn't studied or wasn't allowed to be studied, and it was considered something that is not something that's comfortable for a lot of people to talk about. So based on that, I found to be one of the only people that I knew that had a pretty extensive knowledge on marijuana and the pharmacology of marijuana and on the chemical components of marijuana. So people were coming in and our average patient is an educated patient. They have a background where they went to school. They may be a PhD, they may be a doctor, who knows, they may be a business owner, but regardless, they have questions. And what we found is that we were able to answer those questions and intellectualize it enough to allow people, especially as people became more skeptical and scared to try new medications, easing them to understand the science behind it, to make it more comfortable for people to transition or to accept it as an option of therapy. So really our clinic has become that. And also another thing that happens in our clinic is a lot of people come in and go, I'm on a pain medication. My doctor's been giving it to me for 20 years. Yesterday, I went to see my doctor. He told me that he can no longer give me this pain medication, and it's an opioid pain medication. because of the laws that have changed in the state and in our country with opioid dispensing. So now I'm not able to get these pain medications, which I've taken for 20 years for my back, and they've worked like a charm. The doctor told me they need to do injections now because they have to try non-opioid therapy, right? So this is a law that changed in our community with doctors. It's not magic. It's not a secret. Everybody should know about it, that regardless of the specialty of your physician, to write opioids has become more of a daunting task, and it's been done on purpose to prevent overuse and abuse, right? So for good reason. But it's become more challenging where doctors now have to use alternative therapies and or at least show attempt that you've tried other things other than opioids before continuing opioids long-term on a patient, which makes sense. And it's a broad stroke rule, like all national guidelines, you know, they're broad stroke, they're meant for the general population. So they work well in most situations, but not in everybody's situation. So once you get to the certain demographic where someone goes, I'm at low risk of abuse, I've been on this medication for 20 years, and now you're telling me that you need to change our process, that becomes a huge challenge. And we're seeing a large volume of patients who are coming in saying, listen, my doctor can't give me my tramadol anymore. Or my doctor can't give me my Percocet anymore. Or my doctor can't give me this. And I don't want to try injections in my spine because I know someone who had a bad outcome from that. So people are coming in saying, hey, Shawn, I want to get off these medications. Interestingly, it sounds crazy, but interestingly, we can take people off medications using marijuana. Not all medications, but a lot of medications. And the way to understand that is to understand that marijuana, the way I tell people, and this is my school of thought, is marijuana is a drug. Not because the United States government says it's a class 1 or it's a controlled category 1, not because of that, but because it's a drug, just like methylxanthines are a drug included in the caffeine we're drinking. Just like alcohol is a drug when the beer we drink and all that stuff. So these are drugs. So if we treat marijuana like a drug and we understand how the drug works, we can understand why I'm not crazy by saying I can get you off certain medications using marijuana products. So, you know, marijuana is a potent anti-inflammatory. It's been studied extensively. And what I tell people is there's a huge amount of Canadian studies. And I understand that in the United States, we look at American studies, and I totally understand that. But in this situation, I think it's fair to look at international studies because marijuana has been around forever and we haven't had the ability to study it. So if you look at these international studies, which I've looked at for years now, and you look at European data and you look at Canadian data, you can see that marijuana has been studied against aspirin. Marijuana has been studied against hydrocortisone as an anti-inflammatory. And these in vivo studies, which means real-time studies, have shown that it's 20 times more potent than hydrocortisone. And it's 10 times more potent than aspirin in terms of anti-inflammatory effect. So that's cool and that's great. And I love to hear that. But the idea is, how do we capitalize on that medical benefit of marijuana to use it? And that's really where what we've done at the Healing Center is we've come up with different protocols. They're not proprietary. I've created them myself based on experience and pharmacology, but they're not proprietary. And what they are is they're different regimens. So instead of so most people have the misconception that you're going to go see a marijuana doctor, and I can't speak for everyone, but you go see a marijuana doctor and you go in to see that doctor, and it's a marijuana doctor, and they go, here's your license. And you go, cool, thanks. And he goes, okay, cool, man. Have fun, bro. Take care. And honestly, we're trying to change that idea of that being a more casual environment to making it a more formal interaction, and to telling people that, you know, you're not just going to get a license blindly. What we can do is get you a license, but we can also guide you on the type of treatment you should take. Sorry.
You muted yourself, Shawn.
No, Shawn, you didn't. We hit the button accidentally. Shawn, you were just, you were like 3 sentences ago is when we accidentally lost you. My apologies.
Okay, I don't know what I was saying, but
it was really important too.
it was really that's great. So what I was saying is there's been in vivo studies, right? So marijuana has been studied in vivo, which means real-time studies showing it's a potent anti-inflammatory. So what we want to do is to capitalize on that medical benefit. and people think the misconception is that I'm just going to go to a doctor and they're going to give me my marijuana license and say, figure it out and good luck. You know what I mean? And that's really what the majority of clinics have become. But what we do different is we do this guided approach where we have non-proprietary regimens that I've created based on the 100 people I've seen with migraines, or the 1,000 people I've seen with arthritis, or the thousands of people I've seen with Parkinson's. Right. So the idea is to use guided regimens to treat marijuana as if it were any other medication, and to be responsibly ordering it for people. And I find that that's what's really geared us. And I think that's why we're seeing a lot of the population that are in the older age group above 60 who are more comfortable with understanding what they're taking rather than maybe a recreational benefit. Right. The side effect of marijuana is euphoria and making you feel good and making you happy and making you laugh. If that was a side effect of any medication that you took, you would not complain. So we treat that as a side effect. Some people like to capitalize on side effects. That's where recreational use of marijuana comes in. And this is really not what we do. We don't market at all, the Healing Center. People say, you don't market? I said, no, I had some friends who helped me market initially in some magazines, but it was just, that was about 5 years ago. We stopped marketing because we found that all of our patients are either word of mouth or from other physician referrals. So I call us the unofficial marijuana facility for MD Anderson. We're unofficial with everything because marijuana is still federally illegal. So nobody wants to really be our partner, but we ultimately see a majority of patients from cancer institutions. We see a majority of patients from different neurologists in the area. So we get a lot of physician to physician referrals. And I think that that's where we've really had a lot of traction in the community. And we've actually been able to show a rewarding benefit for patients and the physicians. So like, I enjoy doing it. I enjoy talking about it. I work in the ICU sometimes. I do internal medicine. It's a hard job. This is hard too, but it's people, you actually get to see people get better all the time. And it works pretty effectively. We've had major successes with our regimens and with trialing people on marijuana products. And our secret is not magic. It's just, we start very low on patients and kind of gauge them up. The big thing behind these type of businesses, they sometimes become, I don't want to use the word gimmicky, but they become gimmicky, and they become almost like it feels like you're spending a lot of money to get this therapy. And the idea was that we wanted to keep marijuana low cost. Where I come from, marijuana is very, very, very low cost. That's just north of the border. It's almost free. It's cheaper than cigarettes, and it's cheaper than everything else. So here in America, we don't necessarily have that situation where the marijuana products may be sometimes less cost effective than they should be. So what we try to do is try to give people the lowest cost option to get their license, and then allow them to have follow-up included in that for the year. So what we do is we say, listen, you're getting your license today, but you're also able to come in to the office throughout this time period and bring your medications in. And I have somebody, myself and another friend of mine who I've known for 20 years who works with me, and he'll be able to guide you on your treatment or tell you what you're doing wrong or tell you where it's not working. And that's been something that's really been lacking in the community. If you ask anybody, and I'm sure we all have friends who have tried to go to the dispensary, they go to the dispensary and they don't know what to get. And they go there and they go, here, I'm here, I've arrived. And then they go, I'm here for my medicine. So the person who's at the counter, God bless them, they're not bad people. I call them marijuana enthusiasts, right? So they're marijuana enthusiasts. They work at the counter. They're not pharmacists. They may have some medical knowledge, but I don't think it's usually not formal. And people are going in and saying, hey, so I have arthritis and I got this license. So what do I take now? And the problem is, you're asking somebody who has no medical knowledge on what you should take now. So what a person will do when they don't know what to do is go with the most common item. If you go to a restaurant and say, what should I get to eat? Give me anything. They'll give you the most popular item. So the most popular item in the dispensary are high THC products that are being sold for the fact that they cause that side effect of euphoria and intoxication. That's really on the majority, not why we're going for that medication. So a lot of people, I think, are lost in that process where they would go to the dispensary, get a license, and then never get the product that's actually suited for them. And then they would say marijuana is a failure. It doesn't work. And then life goes on. Tell 10 of their friends, 10 of their friends don't try it. It tells 10 more of their friends, you know the game. And here we are. And then marijuana, the movement of marijuana in the community doesn't happen because of that. So this is where we've kind of chimed in and said, listen, we're going to help people get their regimen. We're going to tell you exactly what to get when you go to the dispensary. Don't go in there. You're going to look like an expert. You're going to say, I want this. And you're going to say exactly what I tell you. And if you get that and you try that, then I know what you're trying. And then when you come back to see me and tell me that it's not working, then I can adjust it. And if you're telling me that it is working or it's too much, then we can also adjust it. So that's the approach we use there. There's an approach that I call the decreased harm approach, which is what I tell people. And they say, oh my God, you're a doctor and you're telling people to use marijuana. And I say, there's something called the decreased harm approach. The decreased harm approach is, as your doctor, my job is to make sure that you get treated for your condition, whatever it is, anything. So my moral obligation and my duty as a physician, even not moral, even just my actual occupational roles and responsibilities, is to make sure that you get the best treatment you can for your condition. And that means the lowest risk of side effect. That means the best tolerated. That means the best, long-term use, et cetera. So when I tell people is, if you compare marijuana to the alternative, you can see that marijuana is actually the lowest harm option in the majority of the disease processes we treat that for marijuana. So I tell people, like, what's the bread and butter of our practice, right? Anxiety, depression, osteoarthritis, Parkinson's, migraine headaches, and then a host of autoimmune problems. People have rheumatoid arthritis, lupus, ulcerative colitis, seizure disorder. These are other big ones. And then the number, I put that in one category, and then probably half of our clinic, that's half. The other half is malignancy. People who have a history of cancer, whether it's newly diagnosed or a history of cancer with associated pain. These are really the kind of the bread and butter of our practice and what we see. And we've had major successes with people coming in, starting chemotherapy, saying, I'm so scared, I'm so nervous, and I'm worried about this, and I have pain, and I have this. So what oncologists have started doing is saying on the front end, when you get your packet that, hey, you're about to go on this oncology journey because you've been unfortunately diagnosed with something, but we're going to treat you. They're actually implementing medical marijuana on the front end. Why are they doing that? A, because it's an amazing antidepressant. It's a great anxiolytic, right, for anxiety. It's an anti-inflammatory, so it helps with pain. And also, it has unformalized data on treatment, concurrent treatment with chemotherapy in other countries, helping outcomes. We don't talk about that because it's not formalized data. So I believe in evidence-based medicine. Everything I tell you is based on a study I've read or statistics. So what I tell people is that's not evidence-based, but there's a lot of things that aren't evidence-based that we do. And that's why the oncologists in Jacksonville have really taken a real interest in medical marijuana. And Mayo Clinic itself, informally, a lot of our patients come from the Mayo system. And they tell me that, hey, my doctor at Mayo told me that this would be a great option based on the data that he's read. And he couldn't tell me that, hey, Mayo is going to get you medical marijuana because it's federally illegal and no one's doing that. But he did give them the option that, hey, there's a clinic out there that would probably be suited for you. And we're getting a lot of referrals from that. And, it's really, a lot of it is education. Most of my job, I tell people, is education, telling people that if you and I have an argument, the first thing you should do is raise your voice. After that, if you don't agree with me still, then maybe you would get more aggressive. But if you started with the most aggressive approach for everything, that's not a good rule in life. And my dad taught me that, so if you don't like something, talk about it first, then maybe escalate to the next steps. So if you have depression and or you have a situational issue where you're having, you have anxiety from a situation, and I put you on an antidepressant for the rest of your life, that in my medical opinion, in my personal opinion, there are many more alternatives that may be not as cost effective or as instantaneously beneficial that would work, that you need to exhaust first before you go to that medication. And I think that's where our clinic has really become a place where people are trying to avoid getting on medications. I tell people a couple cool things. I say, not cool things, but real things. I say, the more medications you're on, the shorter your lifespan is. People look at me like I'm insane. I say, if you're on more medicine, you don't live as long. And they say, oh my God. I say, well, anybody can tell me, well, a confounding variable is if you're on more medicine, that means you have more sick, you're sicker, you have more medical problems. So you're on more medicines because of that. And that's why you would not have as long of a lifespan as someone on less medication. But I tell people, and this is, I'm sure many of you have seen this data, polypharmacy data in our country. in people over the age of 75. The more medications you're on, the shorter your lifespan is. And so what do we do with that data? Why do we care about that? Well, let's try to attack it from the other end. Let's try to take you off as many medications as we can safely, so that you're in that demographic statistical group where you're on less medication and you have a longer lifespan. So this is kind of what we've done. And we've been able to help people really in the home setting. We do have people who are in the assisted living setting, but we've had challenges, obviously, with people who live in controlled settings like long-term care settings, or even a lot of ALFs because of the legalities. So it's a work in progress on that venue. But my opportunity to speak here was really just to let people know that there's normal people out there who are passionate about marijuana, who can educate somebody, and it's not considered a taboo thing. I'm a real doctor. I see real patients every day. I do this as well. In addition, my wife calls it my hobby, because it's my hobby and I can leave the house. And my buddy who works with me is 20 years and he's like my buddy. So it's like our guys' night, right? We do the clinic. So what I tell people is there's an option to discuss it and to have an ability to, if your patients or if your family members or if anybody wants to talk about it, it's free to talk. We can always have people come in the clinic just for education. And I think that what I wanted to do is have an ability for anybody to ask questions. People have such cool questions about marijuana, and I wanted everybody to have the option. I don't know how much time we have. I talk a lot. So feel free to ask any questions. It's open game.
So if you have questions, feel free to unmute yourself. I've got the participant box up and I can see who's unmuted. But Shawn, while we're waiting for folks to do that, Joanne, you got your hand up literally. You've got the floor, Joanne. And Joanne, you're on mute. Hopefully you can unmute.
And can you hear me now?
Yes.
There you are.
Okay. I have an 85-year-old male. His mind is very sharp, and actually he works kind of in a global industry, but he sits in front of a computer and has had a lot of back issues. And I know that he's tried a number of different, opioids beyond anything I could possibly, I'm surprised his stomach hasn't brought it. But my question to you is there a medical marijuana option that would still allow his brain to be absolutely clear? Because he works literally around the clock because his business takes him to all different time zones throughout the world.
Yeah, good question. So that's good question. So common question. So when you describe his medical issue, the first thing I'm thinking of, regardless of what the etiology is, because I don't know his formal diagnosis, right? I don't have imaging or et cetera, but it sounds inflammatory, right? So it sounds like somebody who's positioning and they have inflammatory issues. So that's a positive thing for us, because marijuana is a potent anti-inflammatory. The issue you're describing is actually a very common issue that people have with marijuana products. And it really stems from not understanding or not being educated on how marijuana works and not getting the right regimen. So when you talk about intoxication with marijuana, the two big components of marijuana that we all hear about are tetrahydrocannabinol and cannabidiol, THC and CBD. You all heard of it. I call myself the Healing Center. It's a pun, right? It's a play on words, THC. So the idea is there's two components to marijuana that we talk about. Now, I'll tell you that there's 150 endocannabinoids that are in marijuana. There's terpenes that are in marijuana. There's so many other things that are in marijuana that I know about, and I can tell you about a bunch of them. But for the conversation, what we always talk about in the United States is just THC and just CBD. It makes it simple for everybody else, makes everybody have the ability to understand it. Now, the difference between THC and CBD is a couple things, but one of the big things about the difference is tetrahydrocannabinol, or THC, is the only part of marijuana that crosses the blood-brain barrier. So that's the only thing that goes into your brain. So actually, when that crosses into your brain and it binds onto these cannabinoid receptors that we are all born with, by the way, which is why it's called cannabis, is what causes the intoxication. So if you went and just got a pure CBD product, so this is the rationale why CBD can be sold at Walgreens, right? My daughter's 4 years old. She could go on Amazon. She's pretty sharp. She can go on Amazon and buy CBD on Amazon and it would be delivered to her. Imagine that. But you can't buy Tylenol on Amazon. Weird, because Tylenol is medically active. So CBD is not medically active because it doesn't cross your blood-brain barrier. And in reality, if you take CBD by itself and you just study it, it's very minimally active alone. It needs to have THC and CBD together in some proportion for them to work. So then people get mad at me. They're saying, well, I tried CBD from Winn-Dixie and it worked. Listen, it has some medical benefit, but it's very, very mild. I hate to use the example, but I do, of non-alcoholic beer. Non-alcoholic beer has 0.0005% alcohol, right? Or something like that. If you drink non-alcoholic beer, yeah, you got alcohol. If you told me you're drunk from non-alcoholic beer, we have an issue here. There's a problem. I don't think that's possible. So this is where I tell people that releasing CBD into the community, my mother-in-law, God bless her, I love her so much. She's a hairdresser at Supercuts. And she was telling me, oh, Shawn, I'm so excited. We have CBD shampoo. I said, oh my God. Wow. So the world, so this is not without risk, right? When you release CBD into the community like that, people start to think marijuana doesn't work because they're not using it appropriately. So what you want to do for a patient like that who you don't want to get intoxicated is you want to have as much CBD as possible and as little THC as possible, if that makes sense. So you want to have as much CBD. So a good reference point is the normal marijuana, and I call it normal, the stuff that kids use to recreationally have fun with, that you can get from your neighbor, that stuff, that's 20%, that's 20 parts THC and 1 part CBD, just a reference point, right? And that's smoked to get intoxicated. It has very minimal medical benefit. So instead of using 20 part THC and 1 part CBD, what if we brought that ratio down to 1 part THC and 1 part CBD? And that's what I would recommend for someone like him, is to start on a 1-to-1 ratio, or 50-50 is what I tell people, 50% CBD, 50% THC product. And I would obviously, I don't condone smoking unless it's ultimately necessary. I tell people that the different routes are available, and the most popular route would be something like an edible route, like a gummy. And the benefit of edible products is they're absorbed sublingually. So you don't swallow a gummy whole unless you're like my daughter, she's weird. But like if you just chew on a gummy, it's absorbed in your buccal mucosa. When you come to the hospital with chest pain and I'm the ICU guy and you go, my chest hurts, I say, open your mouth. Under your tongue, I spray nitroglycerin. Why don't I just give you a pill? Because sublingual absorption is much more rapid. It works now. So when you chew on a gummy, it actually has almost I'm not gonna say instantaneous, but a 15 to 20 minute onset, and it can last 6 to 8 hours. So a guy like him, I would say go 50-50 ratio, take a gummy, it's gonna last 6 to 8 hours. You'll find, use it consistently, you won't be intoxicated. One of 3 things is gonna happen. It's either gonna make you too intoxicated, even though it's little, and then you take even less THC, so less than 50-50. It's gonna be not enough, where you increase the THC a little bit, so instead of 50-50, a little bit more, or it's gonna be perfect.
Shawn, thank you. You've got another question. Kathy, you've got your hand up, and then Tanya will come to yours in the chat box. So Kathy, please.
Thanks. So very interesting, Dr. Chopra. Thank you so much. It makes so much sense, and I'm so glad somebody's treating medical marijuana in a medical fashion, in a way that it very, very logical. What about people who don't live in the Jacksonville area? That would be me. I live in Daytona, for example. Is there a network of practitioners who are going about this the way that you are?
You know, so the issue, good question. So the issue is a lot of the way medical marijuana was rolled out in our state was really not, the recommending side was not regulated, right? They focused the regulation on the dispensing because that's where the money is, right? So I get it. You want to make money, so you focus on where the money is. The money is in the growing of marijuana and selling marijuana. So they didn't do a lot of regulation on people who are doing what I'm doing. So the problem is I can't like openly recommend and say, oh, there's a great guy in Daytona who I know is great, because ultimately sadly, I've had a lot of people go into a medical marijuana place and say, here's your license, and no one talks to them, and then they go home. And then they come see me for free, which I love to do, and say, here's what you actually do. And they have their license already, and I just help them. So what I tell people is, if you see us, your license is good statewide. So if you ever were in the Jacksonville area, obviously we see people from Miami, Jacksonville, anywhere in the state of Florida. And if you do get a recommendation from us, it propagates throughout the entire state. So if you were in Jacksonville and you got a license, which would be a year-long license, and then you're in Daytona where you live, and you went to any dispensary in the state of Daytona, in the city of Daytona, they would be able to recognize our order, and it would be instantaneous.
Well, I hope you will put your contact information in.
I definitely will.
In the chat, or I hope that I'm sure that Laura can help us with that.
Yep.
Thanks.
And then, great questions, both of you guys. Thank you. And then Tanya asked in the chat box, do you see only adults? Do you see kids? So what does that look like?
So good question. So I focus on the age. I focus on 18 and older, but I've had a few patients, and I'm a human, right? So I have some patients who bring in their children who are younger. I work with the Down syndrome population. I have since I was a little child, when my parents kind of got me into that, and I've been working with them a little bit. So I tell people it's a case-by-case basis. I'm a human, and I just tell people I don't want to ruin someone's life, right? So I don't want to put them on a drug that they have to take lifelong as they're developing and as they're growing. Hence, I'm not a pediatrician, and I'm scared of that. But what I tell people is I have a 16-year-old who's failing school because of autism. Well, I have a heart, and I'm a human, and I'm a kid, and I went to school. So I feel, and they brought their son in for me to just talk to him, just to see if it was an option. And we've had amazing success with some younger children. So I tell people it's a case-by-case basis. We don't focus on the younger population. There is people who do that in the community, which I could probably get you a contact for that. But we do see people close to 18 years of age. So I would say the youngest person we've ever seen is 16. And I would probably be uncomfortable with less than that, but we have seen people between the age of 16 and up.
Another question, Shawn, are your services covered by insurance plans?
Good question. So because of the federal law, it's similar to like chiropractic and acupuncture stuff, where because they don't have it formalized, it's not. So ultimately, people have asked questions about, they have flex plans and healthcare spending plans and stuff like that. And I've never seen that necessarily been used. Most people are just paying for their visit. What I tell people is, and this is a true story, when we started, we were free for the first 6 months. We just wanted to be in the space and see what the culture was like. And we actually got in trouble for that. So I got in trouble in a nice way from the DEA, because I was recommending a controlled substance for free. So that was interesting. And I think it was driven by my competitors who felt that, like, why would someone do it for free? But like I told you, I owned the office, and I was a volunteer. So there was really no cost. So ultimately we started charging people. And what we do is we charge people annually. And a good thing to know is the cost, right? It's not magic. We charge people $200 for a visit, and that covers them for the entire year.
Wow.
So as opposed to people coming in. So there's somebody who says, I'll see you for $50 or $100, but then you have to come in every 3 months. The big thing about my population is they can't mobilize and come see me in my office every 3 months. And then what happens is we have the risk of them not getting their medication. And that's worse than never trying it, stopping it abruptly. So what we do is we do the first visit we do in person. We make sure we see people in person. And then ultimately we allow them to have a year's worth of as long as the government allows, of a license. I think it's a year license and a 7-month order. And then what we do is we tell them calls are free, drop-ins are free. These are the hours of our clinic. Come in anytime. We'll squeeze you in. If you have a question, we'll call you during the clinic. So we call them and just kind of troubleshoot for free over the phone and help them out.
Awesome. And Diva, I hope I'm saying that correctly. Divya, you have your hand up. We got about 5 more minutes. So please take us away there. What do you got?
All right, thank you. Thank you, Dr. Chopra, for all that information. I was just curious to understand, what kind of effects have you seen on patients with Parkinson's disease?
Good question. So I have a personal involvement with that. My dad was recently diagnosed with Parkinson's, and I'm in Miami right now taking care of him. Like he's okay, but I'm helping him. So he's my guinea pig a little bit. So I work on him a little bit. But so what I've seen in the Parkinson's population, it really comes down to the severity. So as you know, with Parkinson's, it's such a wild range, right? So it's like such a range of symptoms. So there's people like my dad who are still driving and still not having problems swallowing. And then we actually have patients who are so severe that they come in with their caregiver into the clinic in a wheelchair. So we've definitely seen a lot of amazing effect with cannabidiol, so the CBD component, on muscle relaxation. So we've created a regimen for our Parkinson's patients. With what we do is we start with that same 50-50 approach, where it's a 1-to-1 ratio. The one issue I have with Parkinson's people is a lot of times they have some cognitive involvement. And as soon as you have cognitive involvement and you start putting things in across people's blood-brain barrier, you're asking for trouble. So I try to avoid that. And then, like I say all the time, cannabidiol alone is essentially useless. So what I tell people is, with our Parkinson's patients, is I start on the lowest dose of possible. I usually use an oil regimen as opposed to a gummy, because not all of them can swallow. So this makes it easier. And we use an oil regimen of the lowest amount of THC possible with a CBD component. So a lot of times we're having to go to the point where we have two different oils. It's complicated. And we're making our own mix of a low amount of THC and a CBD. And what we've seen is with Parkinson's patients is it's such a low amount of THC. You don't really see a cerebral, you won't see an effect cognitively, but what you'll see is they start taking it 3 times a day, like a vitamin. And what you start to see is 100% of patients have less rigidity, 100%, right? So it's extremely significant. So 100% have less rigidity. Mood is a huge thing with Parkinson's, as you know, Divya. I'm dealing with my dad's mood. It's hard. So it's a hard thing. And depression goes along with it, and losing, the loss of your independence, et cetera. So we found a huge benefit in the patient's mental status. But the coolest part of the whole thing, I'm a married guy, is the wives or the husbands or the spouses, the caregivers are amazingly grateful. So the caregiver comes back to the next meeting and goes, this has been the best thing ever. We actually went out. We actually got to a movie. He wasn't scared to go for a walk on the beach. We danced. You hear these stories, and I'm soft. I almost get emotional. I'm like, God, this is amazing. But what a cool thing we're doing. So I've seen a lot of that. So what I tell people is the rule, and what you should take from this is the lowest amount of THC possible. Mm-hmm. In the easiest way is either an oil or a gummy. And the lowest amount of THC possible, regardless of where you go get your license. It doesn't have to come to me. There's so many people, but just get that license, the lowest amount of THC possible, because you can always go up, but you can't take it back.
Mm-hmm. Okay, thank you. I would love to reach out to you and get better understanding. I don't want to take time away from everyone, but I'll reach out to you. Thank you.
Totally. Feel free, please.
And then Jackie, one last question. We got about a minute left. So Jackie, please.
This is very great information. And my question, I think you may have answered part of it, that was around dementia, and maybe if you've had any experience around that.
Right.
And
So the dementia patients are interesting and challenging, but what we found is obviously with dementia, there's so many different levels of severity, right? Of cognitive impairment, right? So what we found is with dementia and behavioral disturbances. So people who have dementia and behavioral disturbances, they get the most benefit from marijuana products, because it's all about capitalizing on side effects, right? So we again, it's easy. My job is easy. Start on the lowest dose possible with the lowest amount of THC in anybody in that population, right? And then what you do is they can't always swallow, they won't always listen, so you can use oils and stuff like that. And the idea is when you use it consistently, the secret to this stuff is using it consistently. And when you use it consistently, you start to see better behaviors. The cool side effect, increased appetite. So you start seeing people saying, hey, they enjoy food more. And we've seen a lot of benefits in that sect of the population. Somebody who has mild cognitive impairment and they start using marijuana products, they start to say, hey man, my memory is getting a little bit worse. And I say, well, stop using the marijuana products. It can affect your short-term memory temporarily. Yeah. So that's really no problem.
Oh, I will just speak for everybody here, Dr. Chopra. That was so informative and so, I don't know, just uplifting for all of the different ways it can help people and educate folks. And again, this group that's on here, this is their life. They deal with folks all the time that are suffering from various things, or, the arthritis and all that kind of stuff. And some of us probably ourselves, you might be hearing from. So that was just unbelievably valuable. I speak fast, but I appreciate the opportunity. And like I said, text me, call me. I'm not an angry man. Call me. I'm always available. My phone's on. I got a 4-month-old. I don't sleep. Just call me, man. I'm cool. And we're good. Do you mind, would you put in the chat box, if you're familiar with where that chat box is on the bottom of your screen, if you would be willing to put in whatever contact information you want folks to have for the center, for how to best contact you, all of those kinds of things, that would be awesome. So
I'll put that in there. Yeah, I'll put that in there.
Huge round of applause for Dr. Chopra.
Thank you guys. Thank you.
Just so informative. And which leads me to this one right here. This is the group behind the scenes that plans all of these. Specifically, Pamela, you have been raving about Dr. Chopra and explaining how dynamic and informative and educational and helpful and big heart and all those things. And you are 100% correct. And we can't thank you enough for bringing him to this meeting with us today. So thank you. And then the rest of the folks, they do this all the time behind the scenes. We've already contacted the folks for July on senior nutrition. That is going to be the topic then, et cetera. And right now, this group is really busy, along with Janet Ellen, who's also on here from the Community Foundation, planning that in-person meeting in May to celebrate that 15th anniversary. So big thanks to this group here, very appreciated. And our next one again, May 19th in person. If you'll give us about 30 seconds, let me finish this, and we're going to head over to award those door prizes there. And then Lauren, again, thank you for being willing to jump in and be our meeting sponsor today. Very appreciated. And we'll get her connected to the 2 winners and get the gift cards sent out to them. So with that, we are heading into the Wheel of Names. And our Zoom producer is going to be running that for us behind the scenes. We're going to pick 2 people to get those gift cards. I'll get you wrapped up and out the door. So who do we have? Andrea Spencer. And I'm assuming it's the real Andrea Spencer, not the pretend Andrea Spencer. And I'm joking. So excellent, Andrea, congratulations.
Thanks.
And our next person is Carrie. I think I saw Carrie on here also. Carrie, you're with us. Can't see it, but I think she is. Carrie, are you still here?
I'm on mute.
There
Yep.
you go. Gotcha. Gotcha.
Yep. Thank you.
So,
Thank you.
Carrie and
Okay.
Andrea, congratulations. I'll be in touch via email and get you hooked up. Again, Shawn, cannot thank you enough. That was just fantastic. You can see some of the comments coming in.
Awesome.
And again, and let me grab this and just make sure I'm saving the chat, and we'll put that in the notes that we send out with the post-meeting
Great.
information. And then Shawn, if you do have anything, Lauren, the same with you, if you have anything you want us to attach to an email going out, I don't know if you have a flyer or something, if you want to email.
Yeah, I have a brochure. I'll get you a copy of that just so you
That'd be
have some
perfect.
contact information as well if you
Perfect.
guys need anything. But yeah, feel free to reach out. I gave my email on the thread, and just if you shoot me an email, I'm pretty good. I check my email every hour. I'm still on that level of my life, so I will respond to you pretty quickly. And just casual, no formality, don't stress, no stupid questions, only stupid answers.
Very just a wonderful presentation. It's
Awesome.
it's
Thank
not
you guys. Thank
not
you.
typical that you get to be educated and entertained at the same time.
Yeah, right.
With a lot of laughter and good comments and things like that. So what a joyful meeting today, and so helpful to everybody here. I hope it was a benefit to everybody in one way or another, professionally or personally. And Dr. Chopra, hope your trip in Miami goes as well as possible.
I'm with my
all of your-
dad. Parkinson's got him.
There
Yeah,
you
I got
go.
him.
And thank you, everybody. Have a good rest of your day and a great weekend. And we will see you hopefully in May. Thanks, everyone.